Another key component of healthcare reform is improved prevention and healthcare services, which my colleague, Congresswoman Lucille Roybal-Allard, chair of the CAC's Health and Environment Task Force, will discuss further, and I just want to applaud her leadership and the fine work and all the efforts that she has put into this healthcare reform legislation.
Thank you, Congresswoman Velasquez, and thank you all very much for joining us today. As my colleagues and friends have stated, the Health Equity and Accountability Act of 2009 is a critically important bill that takes the issue of health disparity beyond just coverage and cost. To address this most critical public health challenge in our nation, our bill applies a comprehensive and sound public health approach to address the elimination of racial, ethnic, and cultural health disparities. The Health Equity and Accountability Act of 2009 includes thoughtful provisions to provide border health grants, improve rural health care services, reduce HIV, AIDS, and cancer among racial and ethnic minorities, and promote positive health behaviors in women and children so that they may lead longer, healthier lives. America's health is at a critical juncture with persistent disparities between ethnic and racial groups contributing to our country's diminished health status, the onset of preventable disease, and premature death. The future health of America as a whole will be influenced substantially by our success in improving the health of all minority groups. A key component to achieving that goal is to have a public health approach that integrates prevention and wellness across all healthcare services. So I join my colleagues in support of the preventive measures in this bill, from expanding access to prevention education to ensuring equity in the quality of preventive care. We are united in our determination to ensure that wherever applicable, the elimination of health disparities is integrated into health reform legislation. It is an honor to be a member of the TriCaucus, and I want to commend all those who have worked so hard on this bill over the past years. And I am proud to be an original co-sponsor of the Health Equity and Accountability Act of 2009. Thank you very much. Yeah, I wanted to make another point about why prevention is so important, because we all know that prevention saves lives and it improves health outcomes, leaving our families and our communities stronger and more resilient. And it also has the potential to save our nation precious health care dollars. For example, the Trust for America's Health concluded that an investment of $10 per person per year in proven community-based disease prevention programs could yield a net savings of more than $2.8 billion annually in healthcare costs in 1 to 2 years. That figure grows to $16 billion annually within 5 years. So clearly, in terms of the outcomes of having a healthier nation, we need to have prevention as a part of any health care bill. And with regards to the effort to save money, prevention is key in that aspect as well. So it is clear that prevention has not failed us, but that we, in turn, have failed prevention. And it must be a part of this any health care bill.